Can individual workplaces mandate that their employees be vaccinated?
Well, yeah, Karina. The actual answer is it really does depend. But the clearest and the cleanest way is if, and probably politically the most limited way, is if there is a public health order. So we have them in WA, for example, for health workers. We now have in New South Wales one for airport workers. And in WA, we have one for quarantine workers. And I think South Australia similarly. But outside of that, it gets a bit more complicated, and it comes down to a general right of the employer to issue lawful and reasonable orders. So the question becomes, is mandating against COVID actually lawful and reasonable? And that depends on a number of factors, particularly the nature of the job. So does it involve contact with fellow employees? Does it involve contact with clients? Who are those clients? Are they high-risk clients, for example? Does it involve regular contact with third parties? Secondly, you're looking at, is there anything you can do reasonably as an employer short of mandating the vaccine to quell the risk? And then thirdly, the effectiveness of the vaccine. I think the jury's out on that. And then finally, the personal circumstances of the employee. So in particular, does the employee have a legitimate ground to refuse, such as a medical ground?
Yeah, so the rules, it would seem, are not uniform across the country. So can employers ask their workers to reveal their vaccination status?
Oh, that's a really interesting question. So again, that request would have to be lawful and reasonable in itself. So again, you're talking about the nature of the individual circumstances, but also larger employers would be subject to the Privacy Act and the privacy principles. So that would mean that they'd actually have to obtain genuine consent from the employee. So in other words, you couldn't pressure the employee to reveal that information under the privacy principles. And you'd have to provide the employee with sufficient information to actually make that decision.
That's really interesting. That's the bit that I wanted to ask you about, because I don't want to sound like I'm hesitant at all. I'm fully vaccinated, really happy to admit that. But people have a right to privacy over their health status at work, don't they? So it's a really interesting area, and how workplaces are going to have to strike a balance between safety at work and the rights of an individual.
Yeah, absolutely. And we're seeing, contradictions. Well, a potential contradiction there, or let's call it, we have to reconcile that. And also we need to reconcile, the human rights side of things. And that is, the right not to be discriminated against. And how do you do that in a balanced and a reasonable way?
Yeah, so let's talk specifics. Aged care workers have to have at least one dose of the vaccine by the middle of next month. How do you think that will be policed?
Oh, well, so far they're working on, so we don't have a public health order as yet, as I understand it. So the states have agreed, but it will be up to them to actually devise those public health orders. And there may be there can be, the Prime Minister has said, some variations across the states, depending on risks, depending on supply issues. There might be some exemptions. So that's where policing it might get a bit tricky at the moment, though. Within aged care, there is a requirement to report on levels of vaccinations.